You have to lose nearly 50% of your hair for it to be visibly thinner to the naked eye.
What are some early signs of hair loss that women should look out for?
Early intervention starts with awareness, right?
Yes.
Like anything.
Number one.
So are there people in your family, mom's side or dad's side, that have thinning hair? And you should be aware of that. There's a huge number of things that can affect the hair follicle, but it all starts with genetics.
I actually did a DNA panel, and it did show up for me about being prone to thinning hair. Can you change your genetics? Hey everyone, welcome back to another episode of The Well Drop, where we guide you through simple yet powerful tips to transform your wellness at home and supercharge your daily life. I'm Amber Berger, and today we're tackling a subject that's often shrouded in silence, but affects millions of women around the world, and that's hair loss. Hair loss in women isn't just a cosmetic issue, it's a deeply personal and often distressing experience that can affect everything from self-esteem to social interactions. Understanding the why and the how is a first step towards finding solutions and reclaiming your control. Hair loss during perimenopause is a common issue due to hormonal fluctuations and affects a significant amount of women. It's generally recognized that up to 40% of women may experience some degree of hair thinning by the time they reach menopause, which often begins in perimenopause. That's why we're thrilled to have leading expert on the topic, Dr. Alan Bauman from Bauman Medical, joining us today. Dr. Bauman has dedicated his career to advancing the treatment of hair loss, offering hope and real solutions to those struggling with this challenging condition. He was voted North America's #1 top hair restoration surgeon by Aesthetic Everything for 8 consecutive years and awarded Hair Restoration Surgeon of the Decade. In this episode, we'll uncover the unique aspects of female hair loss, debunk common myths, and discuss what cutting-edge treatments are making waves in the restoration of not just hair, but also confidence and the quality of life for women facing hair loss. So whether you're experiencing hair loss for yourself or you know someone who is, stay tuned. This is one conversation you don't want to miss. Let's dive right in and give a warm welcome to Dr. Bauman. Thank you so much for being with us on The Well Drop.
Thanks, Amber. Thanks for having me.
It is a pleasure to have you. I have many women who are anxious to get some information on The Well Drop here. We love to sift through the noise, and I think there's so much noise when it comes to hair loss. And usually, actually, you first think about hair loss in regards to men, not necessarily women. So I always like to discuss topics of like, why weren't we told this sooner so that we're warned about what's to come? Can you start by explaining some of the common reasons why women might actually experience hair loss?
Sure. I think, first of all, emotionally, women are unprepared for the hair loss that can occur throughout their life. And it doesn't have to be just with menopause, perimenopause. It can happen at any time, even right after puberty. It can happen after childbirth. So there's a lot of times where women notice changes in their hair, not just the texture, but the volume. They may notice more shedding. They may notice changes to their hairline. And there's a huge number of things that can affect the hair follicle. But it all starts with genetics.
Let's pause for a moment because what I'm about to share could revolutionize the way you think about your health and longevity. Are you looking to naturally boost your immune system and balance your hormones, especially as you age? The answer lies in weekly infrared saunas. And let's talk about my go-to, Sunlight and Sauna, a vital tool in my wellness arsenal. Sunlight and saunas are not just about relaxation, they're a science-backed solution to some of the most common health issues we face as we get older. Harnessing the power of infrared, sunlight and saunas help stimulate our body's natural processes in ways that are both profound and essential for maintaining vitality. Let's first talk about hormones, ladies. Regular use of sunlight and saunas can help regulate cortisol levels, which not only reduces stress, but also aids in hormonal balance. This can lead to better sleep, improved mood, and overall increase in energy. It also helps to boost our immune system, making it more robust, facilitating quicker recovery from illnesses. So imagine stepping into your sunlight and sauna and stepping out rejuvenated with your body's defenses optimized and your hormones in better harmony. It's more than a wellness routine, it's a lifestyle upgrade. Don't wait to take control of your aging process. Visit Sunlight and Saunas today and discover how a few minutes of warmth can lead to a lifetime of health benefits. Visit the link in our show notes for exclusive discounts and details to see how you too can integrate this transformative experience into your daily routine.
Interesting. Starts with genetics. Now, if you are prone to thinning hair, I actually did a DNA panel and it did show up for me about being prone to thinning hair? Can you change your genetics? Like, can you pull certain levers that, like, okay, maybe I'm prone, but I'm sort of going to fight the battle, like, going to make sure it doesn't happen?
Well, like with so many conditions in health, the genetics kind of guides the ship, but you can make some turns. You can avoid the hair loss problems for sure.
And is a lot of it for women more hormonal? It's interesting that you said that hair changes can happen after puberty, because actually that happened to me. And I didn't even ever associate it with post-puberty, but like I had gorgeous, like my daughter laughs because she's very obsessed with her hair. And I was like, your hair's so similar to how mine was, except mine was stick straight. And then a lot fell out and it was like half the size.
Sure. So hair follicles are a very complicated organ, and they are very, very responsive to changes in hormone status. As with many things, whole body inflammation, how much you sleep, your nutritional status, your stress level, all of these things can affect your hair. But certainly hair follicles are hormonal. If you think of even just male pattern hair loss, we know for sure exactly what the hormonal trigger is for male pattern hair loss. For women, it's a little bit more complicated.
Yeah, we're complicated beings.
Oh,
What are some early signs of hair loss that women should look out for? I had heard that you don't necessarily sometimes notice until you've already lost a great percentage of your hair.
right. So most people think, oh, well, I'm going to notice my hair loss happening because I'm going to see a bald spot. That's not always the case. You have to lose nearly 50% of your hair for it to be visibly thinner to the naked eye. So most of the signs and symptoms occur many years earlier. So it could be excessive shedding. You go through a bout where, oh my gosh, like all in the brush, in the shower, the bed linens, whatever, you're seeing so much shedding. What happened? There could be a receding hairline, thinning or receding in the temple areas, for example. It could be a loss of ponytail volume, or it could be a widening part line. You may have to find that you have to change your hairstyle a little bit to cover those areas over time. But the signs and symptoms can be subtle, and that's why early interventions and measurements are so important.
Yeah, I think that's like a big message is I'm really coming at it from a preventative standpoint. I actually had a severe hair shedding moment last December where like clumps started coming out and I really panicked. It was sort of like that post baby hair loss. And I was like, what is happening here? And I think it was due. I had like a lot of stress going on at the time. And sort of that was my wake up moment. But how can we avoid maybe getting to that point? Like, are there any like smaller signs to pay attention to that somebody can say, okay, I need to like get on top of this now before they've already lost 50%? Because that's like a huge amount.
Yeah, for sure. I mean, we're going to be able to take a look at your scalp and literally measure with an AI powered microscope, what's the density, what's the caliber of each individual hair in these zones that are going to be affected by hair loss or potentially affected, and then the other areas that are more permanent. So we'll be able to really see exactly what's going on at any given moment. So I think early intervention starts with awareness, right? Yes. Like anything.
Number one.
So are there people in your family, mom's side or dad's side, that have thinning hair? And you should be aware of that. So it's not just a family picnic anymore, but go check out their Facebook pages. If you don't remember, you need to go take a look at them and see what's going on. You may already know that you have a sibling or an aunt or grandmother who had thin hair.
Yeah, does it come from a certain side of the family, like the mother's side or the father's side, or is it both sides? Like usually I thought it was always like the mother's father. Is that right?
Yeah, that's an old husband's tale, maybe. I don't know. Obviously, genetics come from both sides of the family. So if you know your biologic history, that would be helpful. So it certainly can come from mom's side or dad's side. So just like hair color, texture, curl, the pattern of hair loss, when it begins, how quickly it will accelerate, and the endpoints are all genetically determined.
So I like that. I feel like the first step would be, one, check your DNA, get a genetics test to see, are you prone to hair loss? And then the second step would be create a baseline and get your hair tested.
Yeah. If you think that you're losing hair,
right.
You're probably right. And that's what we've learned over many, many years, treating, 35,000 patients, that when women come in and they say, I'm losing my hair, we believe you.
Yeah.
And oftentimes, women don't find that their dermatologists or their medical professionals actually believe them when they say that they have some hair loss. So we're going to certainly look and see what's going on in each different area, and that's why the measurements are so important.
And I think that's actually like a really good point to bring up is sort of like who should you go and talk to if you're thinking that your hair is thinning? Because I actually have two of my close girlfriends who have gorgeous, stunning hair. And when I was telling them that what I was doing about, researching of my hair and growing it thicker, I was like, if I get my hair to be like yours, and they're like, actually, I noticed my hair is thinning and I've always had these gorgeous locks. And I think it's because most of us are in this perimenopause phase of this hormonal shift that it can affect anyone, even if you previously had gorgeous hair or not. And that usually the hairdresser, I think, is probably the first person that people have that conversation with.
Absolutely, because they hopefully know your hair. They know
Right.
what it's been like. They can also look at how much shed is coming out in the in the sink when they're doing the shampoo. They know if they have to change your style or your color or your curl to achieve the look that you're looking for.
Yeah.
So sometimes it happens to us subtly over time, and it's really our stylist that brings it to our attention. And then you have to find a specialist. So your average garden variety dermatologist probably will not have an AI powered microscope to look at your scalp. They may just look at you from across the room, literally. Even if you tell them you have a hair loss problem, they may not even have a microscope available to look at your scalp to see how the scalp health is doing. So they have no way to gauge exactly what's going on. So if you're relying on your local derm, you're going to be way far behind.
I
And
think
so,
that's a really important point is that like you should find a proper hair specialist, which is what brought me to you into finding someone. Like I always say, like find the expert in that field. And I guess typically dermatologists are the experts in skin, not necessarily hair follicles. So I think that's a great question that somebody, if they find themselves naturally going to the dermatologist as their first, person to kind of take another step, to ask them if they have these tools available in their office, because otherwise you're not able to even create a baseline because you have no idea.
correct. I attend a lot of conferences with dermatologists, and I have great respect for the work that they're doing. But usually they're many, many years behind in terms of being able to measure, diagnose, and track hair loss over time, and also to provide the most state-of-the-art therapies and treatments. It takes longer to kind of get into that realm there. And I get it. They're busy with looking for skin cancer and things like that, and skin rejuvenation. And hair is a super subspecialty. So the American Board of Hair Restoration Surgery, the International Alliance of Hair Restoration Surgeons, this is a small group. Even though there are tens of millions of Americans out there that are suffering from hair loss, there's only a small number of board certified hair restoration physicians that actually can do what we're doing.
And we'll put that in the show notes because I think that'll be important for people to find somebody local, and they can also do a virtual consultation with your office. I'm super passionate about your starting point being wellness at home. What are some natural treatments? Like if somebody is noticing that they're having some hair loss, what would be their first step that they should sort of go to in order to try to help their hair from being at home?
Well, if I was speaking to someone, even just casually at a cocktail party or something, and they're saying that their hair is thinning or shedding or receding, we can't do a complete diagnosis. So it's very, very difficult just without those tools to know exactly what's going on. But it starts with the story. So what's going on with your nutritional status? Are you on any special diets? Are you losing weight? Obviously, there's a large push now for medical weight loss. And in the years past, we've seen surgical weight loss, right? Bariatric surgery. And all of these things interrupt your natural metabolism, right? And so when you're not getting enough nutrients and fuel, just as an example, your hair follicles are going to suffer. They're very highly metabolic. And so even just simple changes to your diet could be affecting the color, quality, and texture of your hair and the amount of hair that's on your scalp.
I think nobody makes that association. I don't think anyone thinks of hair being like a metabolic, connected to your metabolic function. And also, I think so many people now going on these weight loss drugs, I'm sure it's probably somewhere in the warning signs, but that hair loss has become a big thing, as well as COVID hair loss.
COVID hair
Have you
loss
seen that?
was huge. And so again, interruptions in inflammation, your autoimmune system, the spike protein causes havoc with inflammation. It causes problems with circulation. Obviously, we all know the heart problems that come from not just COVID, but also the vaccinations. We saw thousands of patients that we treated with COVID related hair loss, vaccine related hair loss, lockdown related hair loss. So, I mean,
It's a lot.
it's a lot. And so some of that is stress related, of course,
Yeah.
but yeah, that spike protein, whether it came from, the lab, whichever lab you want to say it's from, or from that injection, definitely a lot of folks who were in a steady state with their hair took a few steps backward.
Now, are there certain, like, I think most people's first step is trying to find a supplement. Like, are there any supplements that you have found that have worked with your patients?
Well, absolutely. As we said, if you're nutritionally deficient, if you're anemic, you're going to maybe need an iron supplement or change your diet. If you're protein deficient, you maybe need collagen exogenously. You have to take that into consideration. There may be other things that you might need, specifically nutrients and fuel, right? B complex vitamins and so forth are very, very important for hair growth, just as building blocks.
Yeah.
And then there are nutraceuticals. So this is a whole nother level of therapy. Many people have heard of Nutrafol and Viviscal, and Extress is a newer one. These are nutritional products that are basically like an herbal salad in many ways. So we often get questions about Nutrafol, which has an anti-inflammatory
Does it
component.
work?
Absolutely, because here's why. You've got an anti-inflammatory component like curcumin turmeric in there. You've got something that handles the hormones like saw palmetto. You've got something for circulation and inflammation, all that. And so those products are certainly not going to be the same as, an FDA cleared laser device or a medication, a prescription, or some more regenerative treatment like PRP. But it's a good baseline to think about.
As a starting point.
Absolutely.
And then I think what most people get sort of burnt out with these things is because the hair growth cycle is pretty slow. And so you have to really have patience. Like if you're starting with a nutraceutical, like how long does it take until you actually might start to see some progress?
So hair follicles produce hair at a rate of about 1/3 of a millimeter a day. So that's 1/4 of a half inch a month. So anything that you start today, even if you had a hair transplant today, it's going to take 6 months to a year to see exactly how that's affecting you. So that's why we do the measurements. So if you're in the office and we have a baseline measurement, we can then track it at 90 days, 6 months, 9 months, and see.
You like going.
Yeah, to see not only which areas are responding, because you may have areas that respond better or not to different types of therapies. How much are they responding? How much density did you have to begin with in that area? What was the quality of the hair in that area? Is it changing in color and texture and so forth? So whether you're starting on a nutraceutical, one that like we curate, like we said, Extress or a Nutrafol or something under the Bauman brand, we have, Bauman MD wellness system for hair that has the protein collagen, a multivitamin, probiotics, you name it. We've got all of these basic things that are available. You've got to do the measurements.
Yeah.
And so it's more than just tracking your ponytail volume. We need to do a scientific ponytail volume.
Yeah, you need something. I think also people need that sort of like boost of confidence to know that it's actually happening so they could keep, because it is a lot of pills, some of these things. But I think that that's like an amazing starting point. And then what about like low level laser light therapy? Because I think there's so many different ads out there of these laser hats and stuff going on. And someone actually just asked me like, oh, does a laser, if you do like one of those face masks, can you put that on your head? What is someone, if they're in the market for it, what is the right one to buy? Because they are pricey, you want to make sure they're going to be effective.
So let's unpack a lot of that. Of course, in any kind of electronic device, whether it's a TV or even a car, you're going to get what you pay for. And for example, in a TV, price usually determines how many pixels, what's the resolution, right? Whether it's a computer monitor or a TV, you want to make a good investment. You want to have that device for a long time. So lasers today come in all shapes and sizes, and many laser devices on the market don't even have lasers in them. They have LEDs, which are potentially much weaker.
Interesting.
And so you want to look for a laser cap device, and you want one that was designed by a physician. So the turbo laser cap, for example, was invented by Dr. Michael Rabin. We helped him design the turbo laser cap, which has more diodes than any other device on the market. Laser diodes, 25% more coverage than any other device. Portable, rechargeable, lifetime warranty, which is nice.
How many, what do you call them, diodes?
Diodes, over 300 diodes in that device.
Is what you should look for.
Yeah, and it's not just like how many diodes, but the quality of those diodes make a big difference.
Yeah,
so if you're looking at a $5,000 device, that's going to be very different than a $500 device that you see on Amazon.
Right.
Most of these consumer devices, as you know, like if you go to a dermatologist's office, you're going to get a prescription for something for skin that's going to be way more powerful than something you pick up in the supermarket.
Yeah.
But supermarkets, they sell a lot of skin cream. Don't get me wrong. But the more powerful devices are the ones that are going to be clinical grade, medical grade.
And what have you seen in your office with patients who actually use those? Like, does it stimulate the hair follicle? Does it speed it up? Like, what happens?
Yeah. So Our experience with laser light therapy goes back to the 1990s. That was when we got our first in-office laser device. And it was a huge device. It was like a big, huge
Like a
salon hair dryer. No, more than a helmet. It was like a salon hair dryer that fit over your head. I mean, it was a massive mechanical, 250-pound device. But obviously today, yeah, you can get much stronger treatment at home with something like the turbo laser cap, for example. But we know FDA cleared for hair regrowth. We know exactly how red light therapy affects hair follicles. The photons of light get into the mitochondria where they create energy. ATP is the energy currency in the body. You're going to create more energy at the level of the hair follicle. You're going to produce a thicker, stronger, healthier, and longer hair, and probably even a darker hair under the influence of laser light therapy.
Well, that's kind of hopeful for us who have to dye our hair. I mean, I've actually just started using your laser cap, and you can feel like the hair being stimulated. It's kind of amazing. I hadn't tried any other ones. It took me a long time to decide which one to actually get because they are an investment. And so a part of us is trying to make wellness be more accessible. And obviously that price point can be a hindrance for people. But I think if people think about it, that the use of that is a lifetime use, right?
Sure.
And especially yours, I think, has like a lifetime warranty.
Absolutely.
So when you break that down on a cost per day basis, it's much cheaper than buying multiple things that just don't even work.
Right. Like an investment in a car. Are you going to, rent or lease a car, over time you have that payment, or should you own the car?
Yeah.
Right. And so a laser cap device that, even though it might seem like a maybe cost up front, if you amortize that over the course of the rest of your life,
yes,
a good quality laser with a lifetime warranty is going to be your least costly treatment over time.
And I always joke, I say for like women, like just think about like the cost of your handbag. Like you're probably going to get a lot more use out of your laser therapy than you will your handbag, because nowadays people just only want them for like a year or two, and this is something for your lifetime and that you physically are going to then see the difference. And there's such an emotional component. I'm sure women, when they come in, no one really thinks of hair restoration for women. Like, how have you seen the work that you have done affect women emotionally to make them gain confidence, not be embarrassed?
Well, hair we always say, is a very emotional organ, and you don't have to look too far. If you're having a bad hair day, that's not so good, right? And so when you have hair loss, that can turn into a bad hair week, a bad hair month, a bad hair life.
Yeah.
And I get emails all the time from women who are suffering with hair loss, and they're embarrassed many times to go to a salon because they don't have enough hair to style, or they're embarrassed that their kids see them without a decent, beautiful head of hair, which they totally deserve. And so it can be very, very disheartening to hear those things. But on the flip side, when we get them in for therapy and for treatment, obviously the correct diagnosis, get them on the treatment plan, tracking their progress over time so they know to be consistent with whatever the treatments are, whether it's a change in their nutrition or a medication or a laser light device or regenerative treatment like PRP or TED, or even if they need a hair transplant, we're going to see them over time so that we know that they're improving. And if something's not working, we're going to change it, or we're going to dig deeper and figure it out metabolically. Taking a holistic or functional medicine approach is really, really important.
Yeah, I love that you actually go at it from like a root cause standpoint, because I think most people just start at the cosmetic standpoint. But if you don't fix those underlying factors, then you're probably not going to make, I'm sure you can make some progress, but maybe not as much of progress that you have the potential for. Have you seen, some common practices in the hair care industry, such as, keratining your hair extensions, things like that add to hair loss issues in women?
100%. So here's what you need to know. First of all, the hair fiber itself is like your fingernail. Once it's damaged, it does not self-repair. You can slather stuff on it. You can coat it with a nice shiny covering. But once the hair fiber, the cuticle, which is the coating of the hair fiber, is damaged, it becomes more porous and it becomes more prone to breakage. So excessive heat, excessive chemical exposure can damage your hair over time. Now, that doesn't mean you have to give up your hair color or your straightening treatments. It just means you have to be more, let's say, discerning about how often you're doing it and with what products, and making sure you're seeing the correct professional who understands if you have weaker, thinner, finer hair, maybe you shouldn't be doing a Brazilian blowout, okay? Or maybe not doing it that often. I mean, look, we're here in Florida. I get it. We need straightening. We need perming. There's no question. We got high humidity. But
you can see my hair right now. It's very, very frizzy because I never did keratin until I moved from New York to Florida. And then I was told you have to do, I'm also a surfer. So I was in the water a lot and I was thinking it was drying out my hair. I was like, what is going on? And they said do keratin, which I did for a little bit. And then I realized I was like, I think it's making my hair worse. And they're like, no, it's strengthening the hair. Like they kind of, I don't know if it's a sales pitch or that's how they're educated. I don't think they're intentionally trying to like destroy people's hair. They actually think it's better for them, but there are ingredients in there that are toxic to people, like formaldehyde, that most aren't aware of, that can cause other problems when you're especially in this midlife stage.
Sure. In order to straighten your hair, you have to break chemical bonds, and then you straighten the hair, and then you make those bonds solid again. But doing that over and over changes the texture of your hair and makes it more prone to breakage over time. So it does not strengthen your hair; it weakens it. And the same is true with hair extensions. Hair extensions cause a different problem. They put traction or tension on the hair follicle. Remember, the follicle is what's creating the hair fiber.
Right.
If you pull too hard on a hair follicle, first of all, the hair could be plucked out of the skin. That's not so good. If you do that over and over again, you will lose that follicle. You'll lose the ability for that follicle to grow hair. Just like if you overpluck your eyebrows, it's not coming back. And so a lot of women notice a loss of volume and then they go to hair extensions.
Yeah.
But here's the thing. If you overdo the extensions, too long, too heavy, improper attachment protocols, there's 1,000 different ways to get extensions these days, and they're all risky to some extent. So with hair extensions, there's no safe cigarette. You need to know that for, let's say, a nice evening out or a special event.
Today, because more of a problem down the road. I think most people don't even think about that. They just want the thicker, fuller hair. And so the one that I've been familiar with is where they're like tying the knots into the hair very finely so it looks super natural. But that's still technically, even if it seems like it's not that much amount wise, is still pulling on the actual hair follicle.
You have the amount of weight. So that's the hair, the length of the extension, how many strands are being attached to one follicle strand, right? The ratio.
Yeah.
And then how often it's being redone. Is it being moved around or not? Right? Those are all really, really important factors. And the bottom line is that if you ever need a hair transplant, those extensions have now damaged and destroyed the available donor hair.
Ooh.
So that your donor bank is what you have in the back of the scalp, and it does not increase. We have no way to multiply hair follicles yet.
Right.
So stay tuned. But so there's no way to multiply them yet. So if you damage those hairs, you'll have less hair available to move into other locations like the hairline or the temples or the frontal zone, which is very common in female hair loss over time.
Yeah, I think that's an amazing point. I think people probably don't think about that. It would actually be interesting that if you can, I haven't done hair extensions before, but to focus on where you're putting them and probably avoiding that back area just for future potential needs, right?
Or move them around, because it's the tension over time and the weight that's causing the damage. So yeah, I mean, look, hair extensions are beautiful. I get it. And they're super addictive, right? Once you have them, you feel like a model.
Stunning.
Right, exactly. You want Hollywood hair, cheerleader hair. Hair extensions can give it to you, but it comes with a price.
Can you share any particular memorable story where it comes to a woman probably in her 40s and a hair loss story of hers, see how her hair maybe has transformed? I didn't realize actually at first that the front of people's hair is a common place you actually started hair loss. I actually had a friend of mine who she just turned 40 and told me that she was suffering from that. But I don't think she would think, okay, now I need to go do something.
Yeah, well, just like we're seeing our male patients coming in earlier, we're also seeing our female patients coming in earlier. And that's a good thing, because they're understanding that the earlier intervention is going to be more effective. If the follicles are dead and gone, then you're going to need a more aggressive treatment, like a hair transplant. But a lot of women in their 40s are noticing a couple of things happening. Remember, we talked about COVID. We talked about Ozempic and GLP-1 agonists. So these are so common that we see this aggressive hair loss problem that may not have occurred for many, many years in the future.
Yeah.
But metabolic conditions, special diets, inflammation, stress, and all these other biotoxins.
Environmental.
Yeah. Oh, yeah. I mean, well, you live in the city, the environmental toxins on the skin, not so good either. So yeah, women in their 40s are coming in, they're seeing some thinning and shedding. They're noticing a drop in their volume, a widening part line. Maybe they're seeing some changes in the temple areas. The first thing that we would do is get them on that good nutritional regimen, identify any gaps in their, metabolic health and things like that. And then talk about what are the things they could be doing at home. What's the hair homework that they could be doing to help themselves? So we already talked about laser light therapy, those types of things. We can also do things in the office that can help get their existing hair to grow thicker, better, and stronger. So regenerative treatments like PRP, most people realize that works for skin or for joints orthopedically. It can work for hair
Yes,
if you
I
do
really
it
want
properly.
to talk about that because I just did that actually last week. Can you discuss PRP in a hair restoration office and the differences between that and being in a dermatologist's office?
Yes. So PRP is a complete process and protocol. And what we're doing in PRP today is completely different than how we learned to do PRP 20 years ago. And so this is a process that's taken a long time, kind of a well-wrought process to figure out how many platelets do we need to get the biologic effect, and have the equipment available so that we can actually measure the platelets is critical. So there's a whole step process. First of all, are you a candidate for PRP? If you haven't done a measurement before you do a PRP, then that provider has done you a big disservice. Number one, you're not going to know what your response from the PRP
Yeah.
was, and you're not going to know how long that response lasted from the treatment, because PRP is not a permanent solution. Only hair transplant can permanently put the hair back. PRP is something you have to repeat, maybe annually. Many physicians are using low density platelet PRP, and that might be great for skin, not going to work for hair as well. Many physicians are using a series of treatments. They got to come in every month for PRP. That's how you know you're getting a weak PRP process.
Now, what's a question that a consumer can ask their dermatologist to understand the difference of the type of PRP that they're using?
How many
in the office?
platelets am I getting? If your physician cannot answer how many platelets are in your PRP, that's like him prescribing you a medication and he doesn't know the dose.
Okay, I like that.
And there's a very specific dose strategy of PRP that we figured out. And it's not something that we invented. We went back to the literature, this is 15 years ago, to the orthopedic literature to see what dosage of platelet creates increased blood vessel formation. What dosage of platelet increases stem cell mobilization? And all of this work has been done in a laboratory decades ago.
Right, it's
And
all
so
there.
It's all there. You just have to dig it out of the clinical literature and then apply it clinically in the office. And so when we measure your blood, we know how many platelets you're coming in with, right?
So what's
if
like
you-
a range? So,
so you're going to come in with about 250,000 platelets per microliter
Okay.
in the whole blood. Then we're going to do our PRP protocol. We're going to create the PRP using a very specialized kit, right? And then we're going to measure that PRP after it's done. And what we want to see is about, let's call it 11 billion platelets total in about 7.5 cc's. So essentially, we want to get to somewhere about 1 to 1.5 million platelets per microliter. That's the dose that we found works best. And so that's what we've lectured on, presented to many physicians. It's what we teach to providers in the aesthetics world, in hair restoration. But there's other nuance too.
And so when you're doing PRP, how effective is that treatment compared to microneedling?
Well, microneedling is a whole nother ball of wax, because people think microneedling is maybe just a little derma roller. Some people use a little stamp that's half a millimeter. Some people use a mechanical microneedling that they bought on, a doctor pen that they bought on Amazon, creating all kinds of havoc and trauma on their scalp. Some people are coming in for microneedling. We actually do professional microneedling at the end of all our PRP treatments. So the other part of the puzzle is your PRP comfortable? So one of the things you should ask your physician provider when you're getting your scalp PRP is, will I be numb?
That's a good question.
If the dermatologist says, no, we do it without local anesthetic, run, don't walk away.
Right.
Because we know that stress causes hair loss. Why would you want to cause mental and physical stress on the body? We know it's going to affect the hair. So people come into the office all the time and say, well, I tried PRP and my derma didn't work. And they tell me, I did a series of low density platelets. They did it to me. It was painful.
Yeah.
Of course it didn't
They
work.
couldn't finish probably because of
Right.
the pain.
So a ring block is an anesthetic protocol, local anesthesia protocol that we use, same for hair transplant, that makes your scalp completely numb for the whole time. So you don't feel anything.
Yeah. It wasn't that bad. It's more just getting the anesthesia that was like, woo, but because it's in an awkward place. But I think it was a very benign process, actually. I mean, it sounds really scary. It took me a little bit. I'm not afraid of needles or blood, but I think a lot of people are. But all you do is just, you first take the blood, spin it, you numb the area, and then you put it in, you don't feel anything. And then the best part, I think, is there's no downtime. I think that's kind of shocking, that you can literally just like go to the gym and shower that
Absolutely.
night.
Yeah, your scalp might be a little bit numb, maybe a little bit pink that night from the whole process and the protocol. As you experience, we do a laser before and after, of course, the microneedling, so maybe some growth factors at that time as well, included with the PRP. There's a lot of things that we can add to it. But, there's also treatments that for folks that are needle phobic. You can come in and do TED,
Yes, I'd
transepidermal
love to
delivery.
talk about the TED. I think that's what's so interesting. That's actually what brought me in, and then I ended up doing PRP. But tell us, what is TED? Because I think it's really great for people who are not into invasive
TED,
procedures.
very exciting technology using sonophoresis. So sonophoresis has been around a long time. That's a method using sound waves to push large molecules through the skin. So what are we going to push through the scalp without a needle? Well, we're going to use growth factors and peptides, thymosin beta-4, copper peptide, FGF, fibrillized growth factor. Those are the things that we can push through. VEGF, we're going to push those through the skin in a TED treatment in, let's call it 30 to 40 minutes from front to back. And there's no needles. We say no drama, no trauma.
Yeah. So those are all peptides that you're pushing through the skin.
Peptides and growth factors. Yes.
So I know peptides are having a moment.
Absolutely.
And then you also have, that I'm trying at home, you have peptides that you can do drops like in the morning and at night. Can you talk about those and what is the difference between what's in the morning and the at night peptide serums?
Yeah, absolutely. So what we've designed is a peptide formulation that could dovetail with a TED treatment or be used as a standalone in lieu of pharmaceutical intervention. So if you don't want to be on a minoxidil, for example, you could be on a peptide. So there's an AM and PM. And so there's zinc thymolene and copper peptide in the other one. And those are the treatments that you would do in the morning and then at night. So those are two that kind of get paired together.
And is that stimulating the hair follicle? What's actually going on?
So peptides are small little biosignals. And so they're getting through the skin and they're messaging the follicle to turn on and stay on.
Wake up.
Yeah, exactly. Copper peptide's been around for a long time. Many people remember copper peptide as a wound healing treatment. It can also help with skin rejuvenation. A lot of sunscreens contain copper peptide, but copper peptide specifically helps stimulate hair growth. And there's a lot of data on that, as well as maybe even protect and enhance pigmentation.
Amazing. Yeah, I hadn't heard about that. I wasn't aware, but I also wasn't really diving in to learn about it until I needed to. I'd love to talk about minoxidil, and I think a lot of people sort of, after they do their supplementation, that's usually kind of the next step. And there's both oral minoxidil, but there's also drops that you can put on your head. Is there a difference between the drops versus the oral?
Well, absolutely. I think most people remember the old Rogaine as the first FDA approved treatment for women's hair loss, and men's hair loss, by the way. But people who have tried Rogaine usually remember it as a greasy, gooey experience and not really good in terms of cosmetics for the hair. And then many patients actually are irritated from the over-the-counter minoxidil products and often give up way before any kind of results were ever seen. So many people say, oh, it didn't work for me.
Yeah.
But we have two things. We have compounded versions of minoxidil. So those are going to be more cleverly, created, if you will, so that they're more scalp friendly. Less irritation, better penetration with some other ingredients to basically enhance the penetration of the minoxidil on the scalp. And so, but still, you got to use that twice a day. Now, remember, minoxidil, before it was FDA approved as a hair growth drug, was a blood pressure medication. But that blood pressure medication caused hypertrichosis. And we're talking hair like craziness.
I think that's what scares most people.
Right. So we're not going to use, if we're going to use an oral version of minoxidil, kind of going back to the original minoxidil discovery, if you will, we're going to not use the blood pressure dose. We're going to use a microdose. So how do we get a microdose of minoxidil? Well, that, again, requires compounding pharmacy so that we can titrate the dose very, very low, especially for our female patients, and avoid these kinds of extra side effects like hair growth in unwanted places, upper lip and sideburns, very common for women. Minoxidil overdose could also cause water retention. So sometimes we put a little diuretic in with the capsule all in one. But minoxidil can be a game changer, a very powerful treatment.
Very good results with minoxidil. I have a bunch of clients who are actually testing it out on themselves, and they're very happy with it. But does that help to speed up the hair growth at all, or is it just coming in thicker and fuller? What is actually
speed of hair growth is something that's very hard to change. There's nothing really that can kind of speed up your hair. Like we said before, you're talking about a quarter to a half inch a month. Now, your hair might feel fuller, and you might need a haircut or hair styling more often if you're on a hair growth drug. That's because more hair follicles are going to be producing a longer hair. They're staying in the growing phase. So minoxidil mechanism is that's going to turn a hair follicle that's off to an on position, right, to the growing phase, and it's going to keep it in that growing phase for a much longer extended period of time. So instead of the female hair loss process, which miniaturizes the follicle and weakens the hair fiber and also creates a shorter, thinner, wispier hair over time, now you're going to get that reversal effect up to a point.
Right. So just a final 2 questions. So scalp health is, I think, really important. Would you say that that's sort of like the starting point when you're looking at the quality of your hair, that you're starting with the scalp? I know on social media, there's so many different oils and serums. Like, how should somebody even know if they need something for their scalp? Like, what would they do? Go and get it examined?
So the first thing is scalp health is foundational for hair growth. If your scalp is dysregulated, you have inflammation, itching, folliculitis, which would appear like acne, you have an ulceration or a sore or some kind of wound on the scalp, you're not going to grow good hair. So if your scalp doesn't feel nice and normal, if it feels extra dry or extra oily, these are breeding grounds for problems. So in fact, scalp health is so important. I have an entire department, we call it trichology, the study of scalp and hair. I have an entire department dedicated to that. And we have specialized equipment that looks at the pH level, the moisture level, the sebum level, different types of microscopes to look at microorganism colonies and things like that. The microbiome of the scalp is very, very delicate and very important. And so if the scalp health is dysregulated, not going to be good for hair growth. There are many scalp conditions that can cause irreversible hair loss. Scarring alopecia is the result of overactivity at the level of the hair follicle when there's inflammation, and the follicle can literally become destroyed, and it doesn't take long. So this is really, really important. If your scalp is telling you something, you should listen.
You should listen. Yeah, so I think a lot of people probably ignore that and maybe just put things on, but maybe they're exacerbating the problem and they have no idea. So like the key would be, if you are symptomatic, get it checked out by a specialist so that you can actually treat it properly.
100%. How would you know what to apply if you don't know what the problem is?
They don't. They're listening to just people that they're seeing on TV, but it doesn't mean it's the right thing for them. I think that's like the biggest point for us. We want people to own their wellness and take charge. And it does take a little bit of extra effort, but I believe it truly sets you free for the future, that if you go and do your homework, find the right practitioner to analyze your hair, then you get the right products to go on your hair, then you're going to get the results that you're dreaming about, rather than suffering and being on sort of a roller coaster.
Yeah,
I
totally agree. And, we have to talk about TikTok trends because, at one moment it's a rosemary oil thing, and the next moment it's like egg yolks, and every month it's something different. So if that's coming up in your feed, and you're seeing all these TikTok trends as influencers that have no hair loss education whatsoever, telling you what you should do for your hair loss condition, it's a message.
Yeah.
It's not a message to go crack some eggs on your head. The message is that you need to say, oh, the algorithm is telling me maybe I should get some medical advice.
Yes. Like, seek an expert. I
Seek
think
an
that
expert.
is like the messaging for today.
Right.
Like, please don't just take that and shift the message of call the expert, find an expert, rather than just trying a bunch of random stuff that's not going to work.
Yeah, please. A TikTok trend is telling you to seek an expert. So
yes, I like that. So to close out this amazing chat, what is one drop of wellness wisdom you'd like to leave with our listeners today?
Wellness wisdom. Well, my favorite wellness wisdom is vitamin G, gratitude. So I thank you for having me on your podcast. I really appreciate it. My mission is to help more people who are out there suffering with hair loss, and that includes men and women and children. Anybody who's out there suffering from a lack of hair, my mission is to help them. And so to spread the word to those folks who are out there, whether think they're seeing the signs of shedding, thinning, receding, they're noticing some kind of change in their hair texture, or they think they might just be at risk. This is their sign to go seek an expert and reach out. And of course, I'm available to answer any questions that they might have, or if questions come back in from the podcast.
Yes, absolutely.
I'm available.
We'll do a Q&A with Dr. Bauman.
Yeah, so I'm happy and available to do that, because that will help us and my team fulfill my mission.
I love
I'm
that.
grateful for you. I'm grateful for my team. And
Thank you. No, we're so excited to really, hopefully, after listening to this conversation today, leave people with hope, that there is hope. So if you're feeling hopeless, like nothing has worked, you're just at a loss and you're just going to have to like suffer and like put a wig on. Like there are ways around it to try to help you get to a better place. And just to find, we'll put Dr. Bauman's information in the show notes and, reach out to his office or find somebody if you want to see them in person locally near you. We'll put also those different credentials that you mentioned earlier. And I think that's so helpful. And really for us and for you, I really love it, just spreading the word that there are ways out there and that you don't have to suffer in silence.
Absolutely. That's why we're here. That's our mission.
Thank you.
Thank you so much.